Now there is something called PSA velocity. And what that is how quickly your PSA increases each year. Now your PSA should not increase by more than 0.75 per year. And it shouldn't happen over a 2-year period. If that happens, that's concerning for too quickly of an elevation of the PSA based on this velocity criteria. And again, it's usually someone that would undergo some type of prostate biopsy to check for the presence of cancer. So that's PSA velocity. Benign prostate tissue should increase linearly. Cancerous prostate tissue, with regards to PSA, usually the PSA is going to jump up quicker over a shorter period of time, which again is PSA velocity. Now there's also what's called PSA density, which looks at your PSA value in relation to the size of your gland, because larger prostates will typically produce more PSA. PSA density is simply taking your PSA and dividing that over the volume of prostate. So if you have a PSA of 4 and a volume of 40 grams, that's 0.1, which is what you want. You want your PSA density to be less than 0.15. And that's PSA density. You know, there's many things that are used with regards to PSA to find out who should be biopsied, who we should watch. And there is an art to it, you know. So a lot of it is following these numbers, using clinical factors, the density, the velocity, the exam, what the prostate feels like on exam, and then coming up and having a shared decision-making process with the patient to decide whether or not they should undergo that next step, which is a prostate biopsy.